definitely. I really think this book is going to connect with a lot of people, and we should say thank you as well, because you've made an exception.
I have an advanced copy here. The publisher sent me a few advanced copies, and I was very blessed because in the hard copy that will come out, which will be even a better cover and so forth, we put in bigger print here, as it should be. It should actually be a bigger print than the print of my name, and that is the foreword, which is done by the Dalai Lama. It was a beautifully written foreword, and of course, every patient's story is really heartwarming and very inspirational. And everybody that's read the book has told me they can't wait till they get to the next patient's story. Yeah. So, and people started on an airplane, they get off the plane, they still keep reading, you know.
Oh, I can imagine, because the stories are, they've all got this thing in common, the everyday miracle, but everybody has a unique story. And we're really grateful that you featured James's story and the story of Ames as well, which was an exception to the rule of the stories that you've included in that book. But we know that on this side of the pond, there's a lot of anticipation. People are really looking forward to reading the book. So we will be putting the links to both of these books, the textbook and Everyday Miracles, in the comments for this video as well. So you're working on this new trial at the moment to make it safer, and hopefully one day make this procedure an outpatient procedure. What else are you doing? What are your plans for the future now? What else have you got? Because you never seem to stop. You're always doing something.
So that study is actually open and ongoing at Scripps. I'm leaving tomorrow to go there. I'll be seeing patients there for that. We're also opening some other newer trials based on what we've learned. The one right now, the two studies also at the IRB there that'll be opening shortly are transplant for scleroderma and for neuromyelitis optica. Neuromyelitis optica used to be considered MS, but it's a different demyelinating disease. Both those are actually explained in my lay book, and down the line we'll open some more autoimmune trials. But I'm also developing my IPS work, because we've kind of invented a technology for IPS where we found we can repair any organ in an animal, independent of the animal's immunologic differences, or MHC, with the cells we're using. And it's been very, very safe without risk of tumors or other late complications. And so really what our modified IPS cells are, a nurse cell, a mother cell that repairs damaged tissue independent of what the tissue or organ is. And so we found it works for repairing neurologic damage, actually helping neurons regenerate, whether it's a spinal cord that's severed or the brain itself, that it repairs, helps repair the heart and improve heart function after a heart attack. It repairs wounds. We've even found it makes animals more intelligent. I kind of call that my flowers for Algernon experiment, and it's a book that made a movie called Charlie. So, but we definitely, you know, as an animal gets older, it's not as adept in learning. I think probably the same is true for us. But we found by treating with these that they're actually smarter than young mice, and they learn very quick and they remember. They learn faster, and then they retain that memory compared to age-matched older mice not treated with the cells or treated with the media. So we are hopeful. My focus is I need to get some grants out to get more funding and to get these going to treat degenerative diseases, a lot of which are related to old age, but also traumatic diseases. And
so many applications for something.
But there obviously are applications for these cells to progressive MS, where you're dealing predominantly, especially late progressive MS, with a late neurodegenerative disorder.
Yeah, very exciting. Can you send us any links to any information at all for any and all of these things that you've got going on, so that we can get that information out there to people who might want to?
The way I've done the IPS, you know, when I did autoimmune disease, and I started on that 35 years ago, it was purely an academic enterprise and share with everybody. But the way we've done the IPS is we patented them, and we have 7 patents for that. And now it's just doing the production. And soon as we get the funding lined up to produce these in a GMP facility, the application to the patient is super, super, super simple. It's an outpatient, just inject them, you're done.
Yes. Yeah.
There's no drugs, there's no chemotherapy, there's no being in a hospital. So it's kind of like, because it's so effective for so many traumatic or degenerative disorders, it's where do we start? We'll want to start with probably, the lowest risk, but I mean, the applications can go on and on, including Alzheimer's. And
yes, that's what I was thinking.
all types of neurodegenerative diseases, secondary progressive, primary progressive MS, but many types of damage to the body. So we'll see. My focus in this coming year will be putting in a grant for that. I'm actually speaking January 5th to the granting organization because I want to get a feel if they're enthusiastic about this animal data and feel like I do, because when you write a grant, it's a lot of time and effort. It's very important. It organizes your mind, but if in the end you don't get the funding, you're like, oh my gosh. So
yes, we know that as a charity. Yes.
So the goal is to work to move that forward. As well as we've established a small biotech company to see this development move forward and get entrepreneurs involved in it that want to contribute to try to make this leap forward faster. Because honestly, as I learned when I started this for autoimmune disease, and I thought in 5 years I'd have all the answers, we're 35 years later, and this is where we are.
Yeah.
I want to see this. Now, there's a lot less risk with these IPS because it's just an injection. You're done as an outpatient, but I want to see this move a lot faster to get to people to help them. So we did that by setting up a company, by patenting, by getting investors, as well as working to get grants, as well as working with a few select organizations such as Scripps to try to accelerate this. So, that's kind of, I've been actually working on that for 10 years. But I'm known for the autoimmune disease I was doing. But while I started in animal models of autoimmune disease 35 years ago, I was working in transplants for leukemia. So, there's always this kind of time lag delay between an idea and the preclinical proof, and then the necessary clinical development, and then the studies and the results. So, I've learned not to give any promises when we'll get there. All I can say is we are trying.
That sounds really exciting. Well, thank you so much for your time today. You've given us a lot of time. I really appreciate it. And I look forward to hearing more about what your work entails as you go forward. Really very exciting things on the horizon.
And I want to thank you so much for getting the information out to patients. That is so, so important.
Yeah.
Thank you for
Well, I think this is because we've benefited so much. It's been life-changing for us and friends that we've made on the journey as well. So for us, it was about paying it forward and giving back and getting that information out there. And so it's exciting now that it is becoming more widely available, and also knowing about what's on the horizon, new treatments and stuff. I mean, this is fantastic. I can't wait to hear more about that and to read your book. So we will be putting the links in the comments. So thank you so much again, Dr. Burt. It's been lovely talking to you today.
Thank you, Alison. Thank you so much. Bye-bye.
Bye-bye. Enjoy the rest of your day.
Thank you.